Hi, I'm Bill Fenn. I received a liver transplant 2 years ago. I came to the hospital, I had primary sclerosis and cholangitis. And you do a quick web search and you find out that the only cure for that is a transplant. And they said, we've got a match in the system, but we won't know until we look at it. You've got to have a good one now because you're really sick. And finally, the 23rd of November, the day before Thanksgiving, it was a 6-hour surgery. Because it affected the bile ducts, they had to take most of that out and reroute, kind of do a gastric bypass and hook my liver to my small intestine. They told my wife the morning of surgery when they came out, and they said they're finishing up, and they said he's going to be in the hospital here another month or month and a half recovering. And so we were, we said okay, and on the 5th day, the surgeon was ready to let me go home because before they had come, they have a heart on the wall that tells you on 12th floor how many times you can go around that floor till you get to a mile. And I did a mile that morning walking, and they said, let's send him home. And my wife and I about fell off our chairs in the room. The CHI Baylor clinic that I go to over there, I went to them to get put on the transplant list, and I did all the testing here at the hospital to get on that list, and they do a wonderful job. I've seen every surgeon at one time or another, the coordinators and all that. They're just a phone call or an email away if you've got a question. When I think about my donor, I haven't met him yet, and I think about, they passed away Thanksgiving weekend, and their family's probably still grieving over that. But I would tell them that I can't tell them enough thank yous for that.